Hello, I'm Dr. Elaine Hart Brothers, MD.
And I'm Dr. Michelle Laws, PhD, and we're with the Community Health Coalition.
The vision of the Community Health Coalition is a society where all people live a long, healthy, active life full of purpose and promise. Since our founding in 1989, the Community Health Coalition Incorporated strives with its partners to reach health equity and to eliminate racial health disparities in Durham County and the surrounding areas.
We hope you enjoy the program that we put together for you today. Thank you for joining us for another segment of the Community Health Coalition's Community and Population Health Discussions. Today we're going to be talking about an issue that has pretty much taken front and center stage on the national forefront, as well as across the state of North Carolina, and that is substance abuse and addiction. Many of you have heard about the opioid crisis that is wreaking havoc in many communities, and North Carolina is among one of the top states that's dealing with this epidemic and this crisis. Substance addiction and abuse during the holiday season seems to be even more pronounced for some families for different reasons. Illicit drug use in the United States, in fact, has been increasing over time. We're seeing increases in different types of drugs and among different types of populations. One that particularly caught my interest is an increase among the population of persons 50 and older. We have with us today someone who can help shine light on what's going on in terms of substance addiction and abuse in North Carolina, and specifically Durham County. James Osborne is a licensed psychologist and clinical addiction specialist. He is also the Director of Community Education and Outreach for Alliance Behavioral Health Center. I am so honored that he's here because he has a vast amount of experience working in this particular area and dealing with addiction. He has held the following positions over a 30-year career: healthcare counselor at Horizon Psychiatric Hospital, the Director of Training at Goodwill Industries, staff psychologist with Durham County Mental Health, the Director of Utilization Management at the Durham Center, and the Director of the Durham Crisis and Assessment Center. We are honored that he has joined us today to help us get a better understanding about the opioid crisis, as well as what we're seeing in terms of trends in North Carolina. Specifically, again, he will speak about Durham County, and also to help talk to us about and educate us on symptoms that we can look for, signs that we can look for in ourselves, as well as loved ones who we may be concerned are experiencing a substance abuse crisis. So welcome, Mr. Osborne, to our show. We're so glad that you're here.
Thank you so much, and thank you for the kind introduction.
Oh, thank you for being here. I want to start, let's get right into it, but first, how did you actually get into this area?
Well, I got into the area because I've had family members that have been impacted both by mental illness and by substance use disorders. And so when it hits close to home, you want to be able to help others. And so it just seemed to be a real natural fit for me. And also a good fit for me is being part of the National Alliance on Mental Illness, a NAMI affiliate that really works on educating, supporting, and advocating for people that have mental illness and substance use disorders, because there's a lot of stigma and barriers that get in the way, a lot of misunderstandings and myths that need to be addressed.
Absolutely. And we'll talk a little bit about what the stigmas are associated with substance addiction and abuse, and what some of the other barriers are in terms of access to treatment a little bit later on in the show. But before, let's kind of set the context for viewers who may not be aware or who may not have been impacted or affected by substance addiction or substance abuse. So let's sort of zoom out and talk about the opioid crisis from a global perspective, and then tie in certainly anything you'd like to share about what we are seeing or what you're seeing and others in the field are seeing in terms of substance addiction and abuse in general.
Sure. So we'll start with some of the facts around what's happening at a national level. And I'm using the Castlight Health report that was reporting that $56 billion is what the opioid abuse is costing our U.S. economy. So $56 billion, and then we have 16,000 overdose deaths that are occurring in the nation on a regular basis related to prescription or the misuse of prescription drugs. So we have 1 out of every 3 prescriptions that are done for opioids that ends up being misused in some way. These opioid abusers also cost their employers twice as much. And it's interesting as you start looking at age differences, it's also the baby boomers that are 4 times more likely to abuse these opioid drugs than the millennials. And you're right on target when you talked about us being in the top 5 states in the nation for the number of individuals that are abusing opioids and also those that are abusing those prescriptions. So there's an individuals, when you end up having the mental health component added into it, those people end up being 4 times more likely. A lot of individuals, and my brother would be an example of one, who started out using them under a pain management type of a system or prescribed in that way, and then the prescription ran out, and then they end up becoming addicted. No one chooses to be addicted, and we really need to use a recovery model to start addressing the issue.
You had mentioned earlier when we were talking before the show about some of the counties that are showing particularly alarming numbers. What were some of those counties?
So when they looked at the number of individuals that use opioids in the nation, we have 4 cities in North Carolina that have ended up in the top 25. Number 1 actually is in the nation is Wilmington.
Wow.
Number 2 is Hickory. It ranked number 5. Jacksonville came in number 12, and Fayetteville came in number 18. And then when you start looking at, again, the prescriptions that end up being used or abused, again, we end up in the top 25 of cities in the nation, again, with Wilmington being number 4, Fayetteville 15, and Hickory being 16. So we've got a significant impact on North Carolina. And again, the report that came out last year was showing that we've had a 584% increase in number of heroin deaths in our state alone.
Wow. So when you think about heroin and opioids, and I guess fentanyl is one that comes up, are those the more common or more frequently used drugs? Or what about crack, cocaine? What about cocaine in the powder form? What are those numbers looking like?
Sure. So in the Time magazine back in 2014, there's crack has actually dropped down, and so it really is the heroin that is. If you're looking at the number of users, we actually have more people using marijuana than anything else.
Wow.
Most people see that as a gateway drug,
Yeah.
medical use, and not seeing as much harm.
Right.
Even though there definitely is significant harm when you look at the age when people start first using it. But definitely if you look at the number of users that have increased, it's definitely within the heroin area that has increased. And
Right.
again, people went to their primary care doctor, they got prescribed something for pain, they were using Oxycontin or Percocet, the prescription ran out, they still had pain, and so they then become looking for something else to take care of that pain versus moving into the kind of the behavior, physical, therapy kind of model to manage pain. And that's where the heroin comes in, and then it gets laced with the fentanyl, and we don't always know what's in there or what the potency is, and that's where we end up with such a high likelihood for an overdose.
Now, I've heard some street terminology in terms of different drugs, so Molly and kids doing things like syrup or making these different homemade concoctions that and salts.
Yep.
At any rate, can you talk to us a little bit about any of those street drugs?
Sure.
Or should we be particularly concerned?
Yes.
And, okay.
Yes, you should be most concerned because the place in which your adolescent children, again, the average starting use here it can be as young as the age of 11, is out of your prescription cabinet at home. So when you have prescription drugs in there, they are going in there and they are getting those prescription drugs. And so there is a campaign at a state level to lock up those prescription drugs and to please go through your medicine cabinet, see what is in there. If you're not using those prescription drugs, please get rid of them. Please get rid of them in a safe way. And there are prescription drop boxes now available. You could use the North Carolina Harm Reduction Coalition website as a place to find out where to safely dispose of those medications, because otherwise someone in your household may be getting at those medications and you wouldn't know it. So you think that you're protecting them from the drug dealers on the street when actually they're getting them within the home.
Wow.
And so adolescents will take those drugs, they will take them to a party, they'll put them all in a bowl. It's called a Skittle party, kind of like Skittles, multicolored pills, and they will take them. The synthetic drugs that you're talking about, like bath salts, is just a variety of man-made chemicals that produce euphoria and actually out-of-body experiences that create those kind of violent behaviors.
So they're like the psychedelic drugs of the 70s?
It is that plus so much more, and again, their bodies overheat, so they tend to take off their clothes. They have superhuman strength. Wow. They, again, really bizarre behavior. So if you're looking at the correlation between violent kind of behaviors and really bizarre behaviors, you really want to look at substance use. Molly is just a nickname for ecstasy, and every single drug has a nickname or a strict name, and it changes, and it's part of keeping up with that culture as far as all the various names that come up.
Great. So what about differences demographics? Let's shift a little bit to kind of look at health from a social justice lens. And what I've heard is that the opioid crisis, going back to that, is now a crisis because it is impacting whites. And I'm hearing references comparing it to the crack epidemic that hit and really ravaged a lot of African American communities in the late 1980s, certainly through the 90s. We believe that the increase, and there's evidence to support it, the increase in incarceration rates among the disparities there among African Americans compared to other segments of the population was largely due to the war on drugs, and the war was waged in poor and already marginalized communities, specifically African American. What's your response to this belief that now we're seeing opioid addiction as a health crisis, whereas the crack epidemic, we responded to it differently? But from a practitioner's perspective, do you think there's merit to that? Did we respond differently?
I think if you just look at the numbers and look over the last 10 to 15 years and look at the use of opioids within the African American community, has remained pretty much stable the entire time. Where you saw the line that definitely skyrocketing was within the white community. And as those numbers reached really high, then that's when they determined that, again, it was an epidemic. And then when you started looking at the number of deaths per year also increasing, which was increasing more, again, within the white community, that's when it has reached into that epidemic type of proportion.
Did we see any of that during the late 80s and 90s in terms of the crack epidemic? Did we respond? Was there ever a health response to the crack epidemic?
I don't remember one. I think that we did start in more 2000s, start creating more of our community crisis facilities and more local detox centers. But at that time, people went in for a 28-day program.
Okay.
And so again, since alcohol was such a bigger issue, I think that kind of took more of the focus when it came to treatment. If you look at people's use of AA versus NA, Alcoholics Anonymous versus Narcotics Anonymous, again, it's just a larger number. The numbers are greater within that area.
Okay. And we already established marijuana is a gateway drug, and we are still seeing numbers, interestingly, with marijuana use among largely teenagers, and then the baby boomers, or
correct. And actually,
probably Gen X. I'm from the Gen X generation.
Yeah, interesting enough, when individuals start having their first substance use admission, between usually 18 and 30s when they have their first admission, about 74% of those people started before the age of 17.
Wow.
But we have another percentage of 10% that actually started at the age of 11. Wow. And at the age of 11, they actually have been using multiple drugs, so it's not just one. And they are able to, again, get those through the medicine cabinet at home, or they may start with huffing solvents within the garage, or again, it's available to them. The main concern with starting drugs that early is, again, that your brain's not fully developed until the age of 25. And so you're dumping these unknown chemicals, and again, potencies have increased and changed over time as drugs become stronger and they're laced with other different drugs that we don't know. And you have those going into a mind or a brain that's still developing.
Right.
Similar like alcohol fetal syndrome.
Yes.
And so it's impacting that tissue and creating a brain that is very different.
Right. So parents should not sit back and allow kids to sniff glue, for example.
Exactly, and I would even more so check the glue, but check your medicine cabinet and lock up those medicines because that's where they are accessing them. Because you don't, I mean, when have you counted how many pills are there?
Right.
And things will just slowly disappear over time.
Right. I want to shift a little bit now to talk about any major areas of concern in terms of substance addiction and substance use that we don't often think about. And I think we touched on some of it a little bit, but
Sure. Well, a lot of the area of concerns were brought out from the governor's task force commission that was put together last year as they were starting to address the reasons that so many individuals with substance use disorders are ending up in our emergency departments.
was this under Governor McCrory or Governor
McCrory.
Cooper?
McCrory. Yeah,
Okay.
this was under McCrory, and this started back in July of 2015.
Okay.
Because they were seeing skyrocketing numbers of individuals with substance use and also mental health within the emergency department and within jails and other crisis situations, and looking at ways in which we can get more onto the front end and push these issues more upstream.
Okay.
Their commission really kind of broke it down into, or their findings was basically that we need more case management to be able to connect people and help people navigate systems because people are falling through the cracks as they're trying to get their needs met. Number two was about the opioid issue and the misuse of prescription drugs. And the third is, again, connected to the incarceration issue, how many people with substance use disorders end up incarcerated and get put in jail, and how can we divert those people to treatment versus putting them in jail, because we're not going to be able to incarcerate ourselves out of this problem.
Right.
And the last area was has it related to housing. How do I get a stable life when I don't have a safe place to live?
Right. And so it touches on a little bit of what we call in my field as social and behavioral scientists, and also in population and community and population health, social determinants of health in the public health field. So that's very encouraging to know that our state is taking that closely a look. It's the holidays.
Yes.
And it's the season to be jolly,
Yes.
right? And that means different things to different people, and how we get jolly, people use different mechanisms to do
Sure.
that. What are some signs that we should look for in terms of substance abuse problems or addiction issues that we really should be mindful of and respond to?
Sure. So I have two acronyms for you. That's the way I can remember helpful pieces of information.
Okay.
The first acronym is CAGE, C-A-G-E.
Okay.
So the C, I know each of these is a question.
Okay.
And if anyone answers yes to any one of the questions, it just means it's worth an assessment and a closer look.
Okay.
So ask yourself and ask other family members, have you been attempting to cut down?
Okay.
So if you have a guest arrive and they're like, oh, I'm cutting down, I'm not drinking as much as I used to,
Okay.
that's probably a warning sign related to C for cut down. A is annoyed. Now,
Okay.
family members can be annoying, but I'm talking about people who are using substances and they become annoying.
Okay.
If they are annoying, or other people have told you that you're annoying when you're using substances, that's another warning sign.
Okay.
The G is about guilt. Sometimes people experience guilt because they said and did things, at the holiday party that they wish they wouldn't had when they show up on Monday morning.
Yeah.
So guilt is another one to be,
Right.
or you feel guilty because you didn't fulfill a duty or something. You didn't get to go to the church service because you got too wasted beforehand.
Wow.
And the last one is pretty obvious, which is E for the eye opener. If people are having to use drinks early in the day in order to just be able to function, which indicates that they're going into withdrawal, then that would indicate that they may have a substance use issue.
Right.
So cage is the thing. If they're trying to cut down, if they're annoying, if they're feeling guilty, and they're having to have an eye opener, those are just simple questions that can be asked to determine whether somebody is could just benefit from an assessment. Like any other health problem, just go get it checked out. Just go talk to somebody. I'm not saying you have a problem, just get it checked out.
Yeah.
The other acronym, or F, there's 4 F words that I want you to think about when you look at the holidays, because it impacts on stress and how people use substances to deal with that stress. And the first one has to deal with family.
Okay.
Family can be stressful. You're not around these people, and then suddenly we have to be together for a certain amount of time. Usually it also involves finances, where people are having to spend a large amount of money, or they feel like they are expected to be able to buy things. And that feeds into the third F word, which is fantasy. That there's supposed to this, Hallmark Christmas and all these expectations, either internally or externally. And the last one has to do with food. People are, and usually it's food and drink, right? If you go to a restaurant, they're pushing both. So people are increasing their consumptions, and again, in our society, we tend to supersize everything.
Now, would you say the F's are triggers, possibly, and the cage are sort of signals or signs to look for? And I like that acronym CAGE, because it could, dealing with an addiction or a substance abuse problem can make you feel like you're trapped in something because of another letter, S, stigma. So let's talk about stigma and the role that that plays in preventing people, or as a barrier for people accessing treatment, or saying, "Hey, I'm dealing with all of these issues. I've got these triggers, and they're shooting on all cylinders, coming, family issues, finances, all of that, and then I'm trying to kind of conceal it, or I'm feeling trapped through all these others." So what about stigma?
Yeah, so at Alliance Behavioral Healthcare, we're really focusing on a recovery-oriented system of care approach, and a recovery base is really focusing on people's strengths. So much stigma is really based on fear and misunderstandings, and believing, again, that somebody just needs to pull themselves up by the bootstraps, or somehow if they were just strong enough, or if they really wanted to, or somehow they could will this away, or even saying it's a spiritual matter. I mean, people look at all sorts of these myths as to why someone may be using substances, when actually it's a medical condition just like any other, related to a brain disorder, and the brain is not functioning in the same way. And so people are, again, there's the nature and the genetic components, and then there's also the nurture and the environment, and there's a lot of theories as to what causes or impacts somebody to become addicted. We just know that nobody chooses to be that way. It's something that happens. There's not a cure, but there is a solution, and it really is a family approach to support, and people can find more wellness and have long-term recovery when people are surrounded by a supportive network.
Are there any gender differences in terms of who accesses care, or who comes and says, "I have a problem and I need help"?
Sure. So we have a slightly higher percentage of this within males versus females.
Who come and say, "I need help," or who hide or conceal it?
Correct. Who come and ask for help.
Who come and ask for help.
Or actually just the prevalence numbers. The numbers of individuals that are diagnosed with a substance use disorder are higher among males than females. Females overall are better at coming and asking for help, though.
Oh, wow.
So they show up more, and so we definitely have. You start looking at treatment gaps. I mean, we're only getting to about like 9 to 11% of the total number of people who have the disorder who even get to treatment.
Really?
And a lot of that has
9 to 11%?
Yes, it's a very small.
So there's a large percentage of people who need treatment who are not getting it for
Correct.
whatever. Why are they not getting it?
Well, one is that they're caught up in the disease process.
Okay.
The same reason why people don't go to the doctor.
Yeah.
So they think they can work it out on their own, and so they delay getting care. Number 2 is that they're not even sure where to get the treatment and how to access treatment. They don't know that it's free. They just see what's on television, or they think that it's going to cost money, or again, no one wants to say that they have a problem. Right. And so they, until something more drastic or tragic happens in their life, it delays until they actually get that treatment available. A lot of our treatment too is also more community based, but it is available.
Okay. So, as a barrier to care or access to care is people stuck in or not willing or not at the point where they're ready to come out of their addiction, right? Generally, when people get help, do they stay in recovery?
Everyone's
different.
path of recovery is different.
Okay.
We don't see it as one being better or worse than another. Part of the stages of change model, it does involve relapse.
Okay.
And so part of the disease is that they may, just like when people go on a diet, they may relapse and have a banana split. It doesn't mean they have to go back to the beginning, but they have to start working their program again and figuring out what works for them. So it really varies by person by person. And again, as you mentioned about the social determinants of health and looking at stress vulnerability models, there's a lot of pressures or stressors that can also impact. But when people are able to have employment, a safe place to live, and then have a solid recovery program on top of that, those are all would be factors that would boost their chances.
Wonderful. And it's so important. I'm going to look into the television and say this. Love and compassion can carry a family member and a loved one a long way in terms of helping them through that entire process, right? So don't give up on loved ones and people that you care about. Help them get access to care. Help them overcome the barriers. Don't participate in the stigma, reinforcing behaviors and shaming people. It is an illness. Addiction is an illness, and the sooner we realize that as a community and as a society, I think the faster we will get people into treatment and on down the path to healing. Speaking of which, what does someone need to do if they are watching this and they are ready to get treatment, to access care and treatment through Alliance?
Sure. So they would just need to call our 1-800 number, which is available 24/7, 365.
What is that?
The number is 1-800-510-9132. If they are in Orange or they are in Carborough area, Orange County, they would call our counterpart, which is Cardinal Innovations Healthcare Solutions, and that number is 1-800-939-5911. I want to really encourage people too, as far as family members, how they can be supportive is to make the call with their loved one. It doesn't, just giving people the number alone and saying call is helpful, and doing it with people and supporting people through those initial steps of getting help is really, can make all the difference. Another resource that's also available for Durham County is the Durham Network of Care. It's an online human service directory, and you go to www.durhamnetworkofcare.org. And all of the resources are there for food, shelter, clothing, but also substance use. So that's a way in which our human services are located on a website, and you can access those there, along with a geo map and finding it. Because really, system navigation and having a guide or support can really make a difference.
Absolutely. And during this time of the holiday season, when, again, people are very expected to be in a very festive mood and enjoying themselves. Any parting words for our viewing audience about how to stay healthy and still enjoy the holidays?
Well, I think the overriding principle is moderation. When it comes to food or finances or some number of substances, you just need to moderate and pace yourself. And just be aware internally of what's going on as far as the stressors. If you're hungry, angry, lonely, or tired, the word is HALT, H-A-L-T. That would be a good way to kind of halt and just kind of stop and take a pause and kind of be more self-aware and do things, approach everything in moderation so that we don't become excessive in any of our activities of the holiday.
Well, it was the L. I want to say lazy, but I know that wasn't it.
Lonely.
Lonely.
Yes.
I was thinking lazy.
Because many times, again, especially during this time of the holiday, people do feel lonely. Even if they can be with people, but still feel that way because they're not with the people that they want to be with. And so that can be very stressful.
That's right. That's exactly right. Well, this has certainly been very informative for me, and I want to thank you for the work that you do and
Thank
the
you.
work that Alliance does
Yeah.
in helping us to get people on the path to recovery and healthy. So thank you so much.
Thank
We
you so much for
appreciate
having
you
me.
for being here.
Thank you.
And thank you for watching. Thank you for tuning in and watching our program. We hope that you found the information helpful.
Knowledge is power, and there's power in prevention, and you have power. So learn your ABCs, the A1C, blood pressure, and cholesterol.
And if you'd like to find out more information about our programs and services or ways that you can live a healthier lifestyle, visit our website at www.chealthc.org. You can follow us on Twitter and like us on Facebook. And remember,
A healthy community includes you.